everybody. Oh man, it is so good to see y'all this morning. All right, y'all. So, first of all, I want y'all to be ready because we have a treat today. This is in one of our new podcasts. You guys are going to be able to listen to it on Spotify, on Apple Podcasts, all of it. So, you know how I do in the beginning of each one of my lives, I like to set everything up. You're going to hear a busy morning, y'all, because I'm momming and busying and doing this and doing that all this morning. And so I want to just tell you guys, whatever you're going through this morning, I feel like it needs to be said. Whatever you're going through this morning, just take that time to relax, enjoy this special. I have a really important thing to tell you that's coming up. And so I want to introduce Dr. Kendra. Welcome to the Learning Project Network. We are so excited to have you here and see you and learn more about what you're doing in the maternal health space. So if you guys haven't, we're going to take a second. We are going to be sharing all of our little links, y'all. You know how I do in the beginning. I always talk about how I need to have an assistant do this part, which is the truth. But we are going to get started here shortly. Comment below. Let me know if you're listening. Let me know if you have questions. We're going to be diving into mental health, y'all. We're going to be talking about a very specific thing as well. We're going to be talking about Strong Black Woman Syndrome. We have a conference coming up on June 9th. It is going to be phenomenal. And I really encourage each and every one of you come out to it. It's going to be online. So it's an all day conference that we're going to be having from 9:15 to 3:15. And I wanted to take some time to introduce our speaker of the whole day, basically. The reason why we chose to have Dr. Kendra come and be a part of this conference is because one, her specialty, y'all about to be amazed. Okay, I literally could not even keep myself together when I was talking with her and learning more about her. But two, you talk about someone that you just felt automatically connected with. You guys know how I do. I really like to connect with people who really feel the vibe that our community has, and they feel connected and they're really organic. This is something that I wanted to share with you all. So please take time to share this short little clip about Dr. Kendra. So Dr. Kendra, welcome. Thank you so much for being here. We are so excited. Tell us a little bit about who you are and what brought you to the maternal health space.
I am a mom, I'm a wife, I'm a I'm an author, I'm a researcher, I wear many hats. But I think one of the things that I am most proud of is just being that mother and using the experience of motherhood to really drive a lot of the work that I do. And just my lived experience, just balancing my life. And so currently I work as a professor at California Baptist University. I also adjunct at Simmons University. And, I work a contracting job where I also do my maternal health, things because I love it. I am one of the co-directors of the Neighbor Project, which is a clinic dedicated and committed to servicing diverse women, specifically Black women, and we focus on specialization care for them. It's a kind of like a pilot that we're doing right now, but I am the co-director of that program, and
Exciting.
yeah, it is very exciting. And so, I do a little bit of everything when it comes to maternal health. So I'm happy to be here. Thank you so much for reaching out and having me. I'm really appreciative of that. I always love sharing my work, sharing what I'm doing. And I'm just, above all else, love being an advocate for my community. I think we're so lacking as Black women, having that support. And
Yes.
so oftentimes needing that voice, and being that voice is important to me because I have two Black daughters that, are going to grow up and they're going to experience a lot of the things that, I have experienced. And if I can change it a little bit for them, I think that's why I do this work. Yeah.
First of all, I listen, y'all. You know I'm about to like control myself talking and rambling. Can I just say I really resonated with that when I literally had my daughter Julia. I came out a different person. I always said it was her birthday, but it was my rebirth. And each time you have a child, you become a new person. Each time you learn so much about yourself, and even the loss of a child. For those that have also lost a child or going through infertility, there's so many different facets that really encompass maternal health that resonate with me because of my experience. But literally, when I had Julia, I literally said, "This is my rampage." Like, I literally cannot imagine growing up in a world, having her grow up in a world that doesn't see her or believe her, and having to uphold this phrase that we talk a lot about, which is the strong Black woman syndrome. And there's a couple things that I wanted to make sure that we say during this session and this conversation. When we're talking about strong Black woman syndrome, we're talking about the expectations that Black women have to uphold in order
Mhm.
to be seen in a certain light. That is emotional restraint, that is independence and caretaking. So when we're looking at those three different things, they really encompass what it means to be a quote unquote strong Black woman. So when you hear that term, how does that resonate with you?
Absolutely. And I really want to kind of give some credit to one of my mentees who really did some work in this area, Dr. Samantha Small. And I was one of her committee, her dissertation committee a few years back, and she really dove into the superwoman schema and what does that look like. And I think that it's really, really important to understand that when we talk about the superwoman complex or the superwoman schema, we're really thinking about, as a Black woman, oh, we have this obligation to kind of remain silent in the moments that we're going through a lot, right? In the moments when we're feeling overwhelmed and tired and stressed out, it's almost as if we have to hide that vulnerability. We have to shield it and pretend like it's not bothering us, right? Even if we're falling to pieces, we have to look put together. We have to look like we're doing what we are supposed to be doing in the society. And so it's like presenting this strength, right? And really oh, I don't need anything, I'm okay, while we're falling apart, while we're
That
neglecting our
part,
own
that
needs,
part.
right? We're neglecting ourselves, we're neglecting what it is that we truly need to function. And I have been there, I have been there where I've decided finally, you know what, I am not superwoman, and I'm voicing that now. I can't do it all. And yes,
Mm,
sometimes my home is going to be untidy. Sometimes I'm not going to cook and my kids are going to eat pizza. Like,
yep.
I'll give my husband a sandwich because it's hard for me to think that I have to go to work seven, sometimes 5, 6, 7 days a week for some women. I'm blessed to have flexibility in my schedule, but I still work that
Yeah.
40-hour work week. And so go to work full time, come home and have to wash and cook and clean and do all of
Mm,
these things and pretend that you're not overwhelmed,
yep.
pretend that you're not stressed out. It's too much to bear as a woman, right? And so it's
Mm,
important to take a break and say, I cannot do all of this. I need help, and voice that. And oftentimes that superwoman is that we don't even say that. We just do it all,
yep.
you know?
Yep. Yes. Th- know who needed to hear that this morning, but literally, we don't have to do it all. And one of the things that really correlates or even impacts the phrase of strong Black woman syndrome is our mental health.
Mhm.
We're going to be doing a conference on Black maternal mental health, and we asked Dr. Kendra to come and speak to us about these two pieces and bringing them together, not only so that we can do better in our everyday lives, but also in our practices as professionals. How do we better understand these spaces? So, if you are a doula, a midwife, a counselor, a social worker, this conference is for you. This conference really is going to help us look at a community of people that have been silenced, pushed aside, or just expected to be strong at all times. So, Dr. Kendra, what can we expect of you when you come in on June 9th over Zoom, y'all? We're going to have an online conference. We'll have the link ready to go for y'all. It's going to be amazing. Tell us a little bit about what we can expect, and one thing that you feel like is really important for you when you were hearing about this conference and why you wanted to be a part of it.
Absolutely. I think it's definitely an important piece. I'm really excited to come and share all of the information. The things that you're going to expect is really me first providing an overview of perinatal mental health, because it is around that. Also talking a little bit about how are we creating safe spaces for Black women in the healthcare setting, and really the importance of screening Black women and the types of screening that should be used.
Yes.
A lot of the times there is screenings that are being used, but it's not really capturing that experience of the Black woman. And so I'll probably bring in some screenings that could be helpful and talk a little bit about, hey, this is probably what you need to do. We need to really sit and build that trust within our healthcare communities, especially for Black women. We know we're not very trusting. And even with my experiences, I was never, when I had my first daughter, and my first and my second, I don't think anyone really assessed my experiences, the social factors that was
Mm,
probably influencing my life, influencing my pregnancy. You're going to the doctor, and there's several things going on. The social determinants of health factors, I'll be talking a little bit about that and how that is also a huge piece in the
yeah.
assessment process of Black women, because looking at those different spaces, things like housing, transportation, and food insecurities. If you're doing a social determinants of health assessment, you'll get information around that, and that will really tell you how your patients are doing,
Mm,
right? What's going on
yeah,
in their lives. So it tells us a story. Also, what are
I
some
love that.
culturally responsive approaches, right? What are some best practices when you're working with Black women, right? And really kind of talking a little bit about that. And so yeah, if you come, you'll get a little bit of everything, I think, that's really relevant and important. And the hope is that eventually I get to go out and visit you guys and be able to do
Yes.
more of an in-depth, kind of conference. But that would, yeah, that pretty much that's what we should be expecting.
Oh man. First of all, you absolutely will be here, Dr. Kendra. I am so excited about this. And for those that don't know what social determinants of health are, that is looking at the scope through education, healthcare, neighborhood environment, social community contacts, and economic sustainability. So
Mhm.
those are some of the different social determinants of health. And so when you are looking at who you are, what you do, how are we, upholding or developing or building or even crushing some of those spaces that need to be crushed and rebuilt, to help create a better community that is supporting all, because the ultimate goal is to how can we support all birthing people in the community, period. For this conference, I want to make sure that people know, a lot of you guys know I would use the term birthing person quite a bit. For this conference, we will be specifically focusing on Black women. You know me right away, y'all. I do not like fake live lives, meaning I am not going to ask someone to speak from a experience that they do not live. I do not like that. I do not do that. And I really try to find people that speak organically and through their lived experience as a person in our community. So you will hear the term Black woman a lot because we are speaking from that lens and we are focusing on that with this conference. And some of the information is probably going to overlap to so many other people and places and spaces. And so take this time to really dive in and learn about what Black women are going through. How do we as a community make the changes, implement new things, think about things differently.
Mm.
We can't look at statistics like the one the CDC gives, which is Black women are 3 to 4 times more likely to die due to pregnancy related issues than white women. And 60% of them, the CDC says, they are preventable. We can't be
Mhm.
outraged about the numbers without talking about the issues, y'all. We got to get in here, and we can't just do it on a clock of 9 to 5.
Mhm.
Sometimes we've got to jump in there and set things aside. And we are asking for our community's partnership with this by one, sharing, two,
Mhm.
attending, get on Eventbrite. We're going to be releasing the link next week. Sign up, get everyone in there. Take that time to say, you know what? We are going to not only attend, but we are going to be intentional with our organizations and our teams. And here in Spokane, Washington, we'll have a little treat for everyone here. Those that are online, we will have a online art exhibit that will be focusing on strong Black woman syndrome. But for my people here in Spokane, we're hoping to secure a location really soon here to actually display the live work of the Strong Black Woman Syndrome and really looking at all of the different spaces and places and challenging us to think about change in a different way. You know, I love the art activism space, and that gives us real clearance to talk and think and share about things in such a unique way. So we will have all of these different images ready to go here pretty soon. So we're really excited about that. So please stay tuned and please keep your eye open so that you can check everything out. Dr. Kendra, one last message you want people to hear about Black maternal health and specifically Black maternal mental health.
I mean, I think it's important for us to really and truly create spaces that listen to the voices of Black women. I think too often we are overlooked, too often we're not understood. And it is important for organization that's really getting our money, getting our insurance, working with us. It's important that policies be changed to address our needs. It's important for them to really and truly not only do performative cultural humility trainings, but actually see what happens after those trainings if there is a
Mm,
shift in culture, if there is a shift in the experiences of the patients. I think it's a lot of us doing trainings for a lot of institution, but I don't know where the follow-up is happening. Like, where's the accountability? Now you've received this training. Are the Black women that's coming to you having a different experience, or is the experience the same? Because then it's only performative and it's not really authentic and genuine, and you really don't want to culturally shift and change the systemic oppression that you have within your organization. So I think it's very important, and if there's one message that I have to share, is that is the message is
mm,
accountability, because I deserve to go in and be treated just as well as anyone else that's coming to your institution. And oftentimes Black women are not. And so I think that's an important piece. And that's my message, is that,
mm.
yeah, and I personally will hold you to that. Right. What are you doing? How have your policy now changed that you have received these types of trainings? Right. Have
Mm,
you looked at them?
mm.
Have you dissected them? Have you made sure that your policies are not filled with racist connotation or racist contents or oppressive language that really doesn't help with the growth of Black women, with the growth of really helping them to have better experiences, right? And so
Yes,
yeah.
yes. Oh my word. Listen, I know we're not talking about music, y'all, but literally I think about this song called Fake Love. We don't need people to fake that they're willing to make the change. We want to see the change. And that's the reason why I keep coming so hard with these conversations, with the experiences that we're creating, with the different resources and toolkits that we are creating. Um, we want to see something different. And the only way we can do that is by jumping full forward head into conversations, trainings, conferences that are not just there to help us listen, but to help us act. And that is going to be my call to action for you guys today. One, get on this podcast and share it with everyone. Two, make sure that you sign up for the conference that will be online June 9th, y'all. It is going to be amazing. And then last but not least, we want you to partner with the Learning Project Network and the Shades of Motherhood Network on some of our community-based projects so that we can actually move things forward. We want to be the people that others look at and say, wow, they're really making a change. They're not afraid of diving in and seeing what's wrong and what they need to do what's right. So ready for this, y'all. I'm going to be pumped. So please stay tuned. Please check everything out that we are sharing. And most importantly, remember that we are here to support our community in a unique way. So we are asking people to step out of the box and step in the fight. Let's crush the crisis today when we're talking about Black maternal health so that everyone can see a better day. Thank you so much, Dr. Kendra. You are so amazing. I am so pumped, y'all. We're going to be ready. Like I said, don't forget it. June 9th. Let's make this thing happen. Until next time, see you guys soon. Bye.